Long time no see, this is YouTube Medical University. Do you know about oral cancer? It's a type of cancer that can develop inside your mouth. And today, we're going to talk specifically about the tongue. Oral cancer is a general term for cancers that occur inside the mouth. Over half of those cases are tongue cancer, our topic today. Some may wonder, can you really get cancer on your tongue? That kind of carelessness is actually the most dangerous. Moreover, there's been a recent change. Even people who don't smoke or hardly drink alcohol are being affected. Tongue cancer is increasing among those kinds of people. It's especially rising among young people. According to a study by Tokyo Medical and Dental University that tracked cases over 20 years, tongue cancer. Among patients with tongue cancer, the proportion of young people under 40 was about 8% in 1997, but about 20 years later, in 2016, it had increased to 15.8%, about double. Why is this happening? Actually, it's something that's hardly ever talked about on television. There was an unexpected real culprit. It's your jaw. In today's lesson, from the real cause of tongue cancer to things you can do yourself, I'll clearly explain self-checks, as well as how to prevent tongue cancer and information about screenings. In the second half of the video, I'll talk about oral cancer screenings and I'll cover costs and systems for free screenings as well. Please watch until the end. In the first part, we'll discuss the true nature of tongue cancer and its surprising cause. In period 2, we'll review the 5 self-check points. In period 3, we'll discuss prevention and the importance of screenings. In 2015, there were about 7,800 cases per year. As of 2020, it's predicted to reach about 10,000 cases per year. Of course, the aging population is also a factor. However, what's important here is who gets it. Oral cancer was originally considered to be more common in men over 60. That's because the main risk factors are tobacco and alcohol. This is the textbook knowledge. However, as I mentioned earlier, in a study that followed patients for 20 years, they tracked 369 cases of tongue cancer. When they gathered and examined the younger patients, about 40% of these younger patients drank alcohol, while about 60% of the older age group drank. The smoking rate was also lower among the younger patients. What does this mean? In other words, tongue cancer is increasing among young people who neither drink alcohol nor smoke. This study suggests that one of the reasons for the higher incidence of tongue cancer among young people is mechanical stimulation. Mechanical stimulation was observed in about 90% of the younger group, the young people. In other age groups, mechanical stimulation was... What exactly is the mechanical stimulation observed in more than 90% of young tongue cancer patients? It sounds complicated, but it's actually simple. Mechanical stimulation refers to our teeth continuously coming into contact with the tongue inside our mouths. Specifically, it means that because of poor tooth alignment, the sides of the tongue are constantly rubbing against the teeth. It's not just about poor tooth alignment. A narrow dental arch, in other words, having a small jaw and crowded teeth, means there's no space to rest the tongue. This can also be a cause. In this study, among young people with tongue cancer, about half had dental arch abnormalities. In other words, their tongues were constantly rubbing against their teeth due to misalignment. And surprisingly, 60% had a narrow dental arch. In other words, their jaws were small and their teeth were crowded, so their tongues were constantly touching their teeth. There were people like this in the study. And there's also an interesting study like this. It was conducted at a university in India in 2025. They performed magnetic resonance imaging scans on 50 patients with tongue cancer and 50 healthy individuals. Among these patients, they calculated and compared the ratio of tongue space to tongue volume. Since it's tongue space divided by tongue volume, the smaller the space and the larger the tongue volume, the smaller this ratio becomes. As a result, patients with tongue cancer showed a statistically significant difference compared to healthy individuals. This ratio was lower, and those with a smaller tongue space were more likely to develop tongue cancer compared to those who did not. The conclusion is that the risk of developing tongue cancer is about 2.6 times higher. In other words, think of it like a room. The teeth inside your mouth are the walls of the room, and let's say the resident living there is your tongue. If the room is small, the resident will bump into the walls. If you keep bumping into the walls every day, the walls will gradually get dirty, right? Constantly running into walls is stressful, right? In other words, when the tongue is constantly exposed to this kind of chronic stimulation, the cells get damaged, inflammation occurs, and as a result, it's believed that this increases the risk of cancer. So why is tongue cancer more common among young people? The answer is simple. It's because their jaws are getting smaller. Our ancestors used to eat a lot of hard foods. It is said that people in the Yayoi period chewed about 4,000 times per meal. However, nowadays it's about 600 times. When the number of times we chew decreases, our jawbone can't develop properly. However, the size of the tongue doesn't change. As a result, the tongue loses its place, making it easier for it to rub against the teeth. There are reports that chronic friction between the tongue and teeth can damage cells. In other words, it can harm the DNA. I'm sure many of you are surprised to hear that a small jaw might be related to tongue cancer. While you're watching this video, is your tongue touching your teeth? Please check and see. If you look at your tongue in the mirror and see teeth marks or impressions, it means your tongue and teeth are chronically rubbing against each other. It's very likely. Please try to check it yourself. So in the second period, we'll talk about what features tongue cancer has when you feel something is wrong, how it's different from mouth ulcers, and what you can do yourself. I'll explain how to do a self-check. If you found this helpful so far, I'd really appreciate it if you could hit the like button or subscribe to the channel. Your like can help reach someone else who has the same concerns, so please support us. So, this is the second point. The biggest enemy of tongue cancer is that it's hard to notice. Why is that? Because early stage tongue cancer is almost indistinguishable from a canker sore. An oral surgeon I know said sometimes even they can't distinguish early stage tongue cancer from a canker sore. Everyone has experienced canker sores, right? They hurt when you eat, but after a few days they gradually get better. However, it's different in the case of tongue cancer. Tongue cancer has several important characteristics, so let me introduce them. The first point is the location. As I mentioned earlier, the most common site for tongue cancer is the part of the tongue that comes into contact with the teeth, which is the lower side or the lateral side of the tongue. It's quite rare for it to develop on the surface or in the middle of the tongue. Most tongue cancers develop on the edge of the tongue, so please remember that. Next, let's talk about its appearance. Early stage tongue cancer often appears as white or red spots. These are called precancerous lesions, which means they are one step before becoming cancer. The third characteristic is the texture, or how it feels when you touch it. In the early stages, it's hard to notice, but as tongue cancer grows a bit larger, it often comes with a hard lump. In the case of a canker sore, it usually stays soft. So, if you can't tell by appearance, it's important to check for yourself by touching the area to see if there's a lump. This is an important self-check. And the most important thing I want you to remember today is the changes that happen over time. In the case of a normal canker sore, it usually heals within a week, or at most within 2 weeks. However, if it doesn't heal even after 2 weeks, it's quite rare for a canker sore to last that long. In such cases, you should be cautious about tongue cancer, especially if the sore is getting bigger or has an irregular shape, or if it starts to bleed. If you notice any of these features, you should be careful. So please remember the 2-week rule. If it doesn't heal within 2 weeks, the canker sore might not be just a regular canker sore. Please consider seeing an ear, nose and throat specialist or an oral surgeon as soon as possible. Even if it's not tongue cancer, the fact that you keep getting canker sores could mean there's an underlying illness. In any case, I recommend seeing a doctor as soon as possible. With that in mind, let me briefly introduce some simple ways to self-check your tongue. The first checkpoint is to look closely at the sides of your tongue in the mirror. Open your mouth wide. Stick out your tongue and try moving it from side to side. Check if there are any red or white spots on the sides of your tongue. The second checkpoint is to look at the underside of your tongue. Try curling your tongue upward. Pay special attention to the area where the underside of your tongue touches your teeth, especially along the edges. Make sure to carefully check for any abnormalities around this area. If you don't pay close attention, it's easy to miss subtle changes. The third checkpoint is to touch it with your finger. With clean hands that have been washed, gently touch the sides of your tongue. Check for hard lumps, surface roughness, or differences between the left and right sides. Please confirm these points. If you notice changes like bleeding easily just by touching it a little, that can also be a sign of tongue cancer. The fourth checkpoint is pain or numbness. In the early stages of tongue cancer, there is often no pain. However, as it progresses, you may feel a stinging sensation when eating, numbness in your tongue, or it may become difficult to move your tongue. Some people experience these kinds of symptoms, especially if these symptoms appear only on one side. It is important to be cautious about tongue cancer, so please check carefully for any pain or difficulty moving your tongue. And fifth, as I mentioned earlier, there's the 2-week rule. If any of these changes persist for 2 weeks, do not improve, or even get worse, please make sure to consider seeing a specialist. Please try to do these self-checks at least once a month or even once a week if possible. If you have a mirror in your bathroom, try to make it a habit to check yourself after taking a bath or after brushing your teeth. Even 30 seconds is fine. Please try to make it a habit to self-check your own tongue. If tongue cancer is detected early, the 5-year survival rate is about 90%, which is very high. However, if it progresses to stage 4, the 5-year survival rate drops to about 18%, 90%, and 18%. This difference depends on whether it was detected early or not. If found early, it's a cancer that can be cured, so please be conscious of self-checks. Now, lastly, the third point. Here are some recommendations for tongue cancer prevention and screening that you can start today. We've had some scary stories, but there is also hope. Tongue cancer can be partially prevented through daily lifestyle habits. First and foremost, the basic prevention is: number 1, quitting smoking and drinking in moderation. Oral cancer refers to all types of cancer inside the mouth. Smoking and drinking are established risk factors for oral cancer and esophageal cancer. According to some studies, people who have both of these habits, it is said that the risk is about 4 times higher. The second point, which may be surprising, is that keeping your mouth clean is also important. Brushing your teeth is important, but also clean your tongue and treat cavities or gum disease promptly. Don't ignore sharp teeth or dentures that no longer fit properly. These kinds of measures are important. It's not just mechanical irritation in your mouth, but also some kind of inflammation that can occur. That itself becomes a risk for oral cancer in that area, so you should check your entire mouth, including your tongue. Visit your dentist regularly. It's very important to keep up with maintenance. And the third point, this is something I want people with children to really understand, is to chew your food thoroughly. Children today mainly eat soft foods. If you don't chew enough, your jaw doesn't develop properly and becomes smaller, which causes your teeth to become crowded and misaligned. Because the space is tight, your tongue is constantly rubbing against your teeth. That's why it's good to eat things like root vegetables, nuts, or harder breads. The habit of chewing well may lower the risk of tongue cancer in the future. And the fourth point is to check the alignment of your teeth. Actually, I also had orthodontic treatment as an adult, just like I mentioned earlier. Among young people with tongue cancer, about 60% of them had abnormalities in their dental alignment or poor teeth alignment. Do you all have teeth marks on the sides of your tongues? These are called tooth indentations, and if you have them, it might be a good idea to consult a dentist. These are the main ways to prevent oral cancer and tongue cancer, and from here, I'll share information that many people don't know. There is a system for oral cancer screening, similar to those for colon and stomach cancer. Even if people know about them, many don't know about oral cancer screening. You can get an oral cancer screening at a dental clinic. The screening involves a self-check like I mentioned earlier. They look at your tongue, touch it, and check for any abnormalities. There's almost no pain involved. It usually takes about 15 to 30 minutes. If you pay out of pocket, the cost varies, but it's around 5,000 to 10,000 yen. However, some local governments offer subsidies, so it can be free or about 500 yen. There are places where you can get it done very cheaply. Please try searching for oral cancer screening along with the name of your city, ward, or town. You might be surprised to find a place nearby where you can get screened. So, finally, I'd like to share some guidelines for getting screened. If any of the following 5 items apply to you, please consider getting an oral cancer screening. First, if you have something that hasn't healed for more than 2 weeks. If you have a mouth ulcer. Second, if you always have teeth marks on the sides of your tongue. Third, if you have a habit of smoking or excessive drinking. Fourth, if you have crooked teeth or have been told you have dental crowding. Fifth, if you are over 40 and have never had an oral cancer screening. Early detection of cancer starts with being informed. Please consider doing a self-check once a month and getting a cancer screening once a year. Here's a summary of today's lesson. Tongue cancer is the most common type of oral cancer. It is increasing among younger people, even those who don't smoke or drink alcohol. The unexpected real culprit is the fact that modern people's jaws have become smaller. Chronic friction between the teeth and tongue was the cause. Early stage tongue cancer looks very similar to a canker sore. If it doesn't heal within 2 weeks, please consider seeing a doctor. If detected early, the 5-year survival rate is 90%. Please try the self-check I talked about in today's video. In the comments section, let me know what surprised you the most or what you usually try. If you have anything, please share it. Even just a single comment would make me really happy. Subscribing to the channel so you don't miss new videos would also encourage me. A thumbs up or thumbs down is fine too. If you rate this video, I'll do my best to keep improving. Well then, see you in the next video. As a general practitioner, I've learned from my patients how to live agelessly in your 70s and beyond. I want to live this way too. I never realized it was possible. These stories share lessons from many patients. Talking with friends matters more than exercise. In medicine, less is often better than more. I learned these from my elders. It's packed with wisdom on how to live healthily and happily no matter how old you are. Please check it out from the description below.